Hello everybody, and thank you for inviting me to come and join in this really fascinating exchange, and I'm looking forward to engaging in these really interesting sort of cross-disciplinary dialogues. I'm going to be talking about observation use in a clinical context, and I'll explain a little bit about the model that I've been using and that's used quite widely in this country and also particularly in France as a way of supporting and working with children and families in some distress. So the research that I'm going to talk about was carried out in a mental health service for children in care, where I work as a child psychotherapist. And therapeutic observation is a clinical intervention that's been adapted from the kind of observation which Lisa was describing, which is used in training for psychotherapists and in quite a few social care trainings now. In a clinical training, and students, just to sort of run over the method, observe a typically developing baby in their home environment. So that's a baby with no special medical needs, not statutory services aren't involved. There's not going to be a call on the observer to kind of start acting as a clinician. They can just watch. So they observe the baby in the home with the mother or the main carer for an hour a week, usually for 2 years. And this is a method that was developed by Esther Bick at the Tavistock Clinic in the 1940s. It's a form of naturalistic participant observation that allows trainees to learn about child development, but also about the intensity of being with a tiny baby and the drama and detail of relationships as they're unfolding. And the aim is to observe as much as possible, to be responsive. So it's not a sort of still-faced, blank wall, pretend I'm not here kind of observation, but without initiating interactions or giving advice. And over time, students are encouraged to observe the emotional responses evoked in themselves by what they're seeing, as well as the baby's development and their interactions. And as Lisa was saying, there are three important elements to the method. There's the actual observation, usually for an hour. Notes are written after the observation. It's the training in remembering enough so that you write it down afterwards, not during. And then a discussion looking at the fine detail of the notes in a small seminar group, usually 4 or 5 students. So in therapeutic observation use as a clinical intervention, the observer has the same task, trying to see as much as possible, visiting regularly, aiming to be both friendly and receptive, but also at times taking on a more active role. So, for example, putting words to feelings that might be in the air or thought to be there, or gestures that might otherwise go unnoticed, with the aim of supporting the link between parent and child. And for children who are in care, therapeutic observation can help to provide the very often very large professional networks, a team of professionals, often from social care, from health, from education, who are all working to support a particular child, but coming with their own particular perspectives and priorities. So an observational stance, an observational attention and time just committed to observing can help to focus on children's individual experiences and needs, and at the same time can provide a degree of containment for their foster carers who can themselves be subjected to a kind of secondary trauma as a result of the impact of the trauma that brought the child into care. So why investigate this approach with a baby in foster care? Well, infants and young children in care are among the most vulnerable children in our society, but they're very rarely referred to mental health services, despite a plethora of evidence about the formative impact of early experience and the notorious and very poor outcomes of teenagers leaving the care system. So in this study, I wanted to find out more about the experience of a baby in care and about the lived experience of foster carers to inform ways of working in our clinical service. And my first question essentially was about how feasible the project would be. I wasn't sure whether a foster carer would accept the commitment of a regular weekly visit, somebody coming to watch, and whether a social worker would agree to it for a child that they were responsible for. But somewhat to my surprise, the offer was readily accepted. I was able to observe a baby boy who I'm calling Rayhan, it's a pseudonym, for 10 months. So he was 3 months old when the observation began and aged 13 months when it ended, when he moved to an adoptive home. Rayhan was born to a teenage mother and was given up to be adopted at birth. And this meant that he'd not been exposed to the severe maltreatment that's the reason why the majority of children enter state care. Also, quite unusually, he had no placement move. He was in the same foster placement throughout his time in care, so that he didn't have any placement changes, and that meant that the case provided an unusual opportunity to examine the effects of growing up in temporary relationships with few confounding factors, so it was quite good from the research point of view. The project had NHS ethical approval, and I've changed all the names and identifying details, obviously, for confidentiality. So I'm going to kind of run through a bit of a narrative of the observation and then just say a little bit about the data analysis and some conclusions. So the context and beginnings. War, the loss of mother country, and the clash of cultural values permeated the refugee community of Rayhan's young parents. The foster carers Nadira and her husband Darmeen were looking after a child in care for the first time. It was their first time the foster child was placed with them. They had 3 almost grown-up children of their own. As I said, the beginning of the observation felt quite precipitate. It happened much quicker than I'd expected. In place of the wariness or lack of comprehension I'd anticipated, my request to observe a baby with his foster carer was taken up immediately. And this unexpectedly rapid recruitment was very welcome, as opportunities to study infants placed in care at birth are quite rare. But it did mean that there was less time for me to get to know the social workers and their sort of working patterns. I mean, I worked with them as a clinician, but here I was there in a sort of different role. So this is an excerpt from a field note from notes of a meeting with the social worker whose role was to support the foster carer. So for children in care, the child has a social worker, and the foster carer also has a different social worker whose role is to support and work with them. So this is from the notes. It's only when Anne, the foster carer's social worker, tells me the baby's name that I remember that I need to obtain the consent of his social worker for him to be involved in the project. Anne doesn't know his social worker and suggests that I ask the foster carers who she is. So although the research protocol was fresh in my mind, at this point I completely forgot that I had to meet with the baby's social worker to obtain her consent on his behalf for the project. I was quite taken aback by the disconnection that I encountered here in the system, that the social worker whose role was to support the foster carer didn't know the social worker for the baby. But in retrospect, I also thought that this complete forgetting, I'd spent ages working on this research protocol and going through ethics, but I just completely went out of my mind. I think that powerfully reflected my own instinctual denial of this thing called corporate parenting of the baby that I was shortly going to be meeting. But when I met Daniela, the social worker for the baby, I was very struck by the connections that she'd been able to hold on to in her mind, and this is an excerpt from another meeting. So Daniela, who's Rayhan's social worker, recalls Rayhan's young mother, Tamara, saying that she found that she thought most often about the baby that she'd given up in the evenings, and that was when she felt particularly sad. And Daniela, the social worker, links this with Nadira, who's the foster carer, who'd noticed that Rayhan seemed to have a particular kind of a cry in the evenings. And she tells me, Daniela tells me, that the foster family have wondered if this is when his mother is thinking about him. So what struck me here was that a kind of feeling of a living link of emotional life and memory that linked up Rayhan, the birth mother, and the foster family, and that had been held onto and held in mind by the social worker, something that gave meaning to feelings and attachments. So I'm now going to try to describe the beginning of the observation. When I visited the foster family for the first time to talk to them about the project and see if they'd be willing to take part, this was when I had my first meeting with Rayhan, the baby, who's now aged 3 months. I'm going to give an excerpt from the notes. Nadira, a young woman with dark shining hair, gives me a warm smile while holding Rayhan. He is staring at the wall behind her as he sucks on the bottle. His face has the look of a little old man. His features seem large and somehow not joined up. I feel saddened to think that he's an ugly baby, and I'm rather scared by the idea of coming to see him every week. Later, during the visit, there's a sense of still raw shock as Nadira describes the phone call that she'd had from someone telling her to, quote, collect a baby the next day. At the hospital, they had asked her to wait at the door while they checked her identity, and then the baby was passed to her. And she was worried that someone would be waiting outside to fight her or steal the baby. As Nadira recounts the story of their first moments together, Rayhan begins to cry. She lifts him up and holds him close, and then lays him on the blanket and talks to him soothingly. His face lights up, and his whole body quivers. He stretches up his arms and legs and face towards Nadira. I'm moved to see that he seems to have come together. He looks more connected, and his face and eyes have more colour. I now feel drawn to him and more hopeful. Nadira looks at him closely and murmurs, "Shall we sing to Jenifer? She hasn't heard you sing yet." And there's an atmosphere of a quiet celebration. So my first experience of Rayhan as a lost, disconnected being was transformed as he came together with Nadira and then became more joined up in himself. And I felt in myself a shift from fear and even repulsion to hopefulness and curiosity. And these feelings helped me to be able to think and to link the present moment with his past and with his future. Although the placement lasted for 13 months, the foster family had a paradoxical experience of being in almost daily expectation of Rayhan leaving, having heard that he could, quote, he could go at any time. And Nadira was frequently reminded to, quote, remember he is not yours. In the first few weeks, I found that I felt exhausted after these observations. My notes were disjointed and took several hours to write. When I look back at this stage of the observation later when I was writing up, I saw parallels to observations of premature babies where impressions tend to be fragmented. People talk about sort of proto-impressions, proto-thoughts, and thoughts can only come together in the containing setting of the seminar group. In the early months, as I was observing, Nadira was worried that Rayhan always turned to one side, the left, and I saw how she helped him to join up his senses and the parts of his body. This is an observation when he was 3.5 months old. Nadira talks to Rayhan and turns him round so that I can see him. She kisses him and strokes his cheek. She encourages him then to turn towards me. I'm on his right. He turns a little and then turns his face all the way back to the left towards the wall. And then he looks into her face. And she kisses his chin and plays round and round the garden, touching his tummy, his arms and his face in time with the song, while he gazes intently into her face. In the following observation, Nadira talked with her mother on the phone while holding Rayhan, and this is a quote. Nadira's arm is firmly around Rayhan as he leans back into her while she talks with her mother on the phone, who's in another country. He looks relaxed. His eyes are dark and shining. He looks towards me, waves his arms, and kicks out with his legs. And she then gives him a cushion, which is in the shape of a duck, which was an old toy that every child in the family had bitten and thrown away and found it again. And it's got a soft orange beak and eyes. And he takes hold of it with both hands and nuzzles into it, clamping it firmly in his jaws. So what I was struck by here was that when Nadira herself felt connected to her mother, and perhaps too with my gaze, she holds him more firmly, and he looks more together, and he's then able to reach out to me and to engage with this toy that became an important transitional object for him. Now, in the middle period of the observation, a rather depressed atmosphere set in while we were waiting for an adoptive family to be found for Rayhan. There was a sense of ordinary life being on hold for the foster family. For example, they weren't allowed to take him away with them on holiday, so they didn't go on holiday. They didn't want to put him with a different family. Nadira dressed him in baby grows and seemed to be holding off from putting him in little boy clothes, and she herself was often wearing pyjamas when I came to visit. So the two of them, in a way, seemed quite merged. At the same time, I was struck by how forcibly the prospect of their separation came into my mind with each developmental advance that he made. This is an observation when he was nearly 6 months old and now sitting up well. Nadira puts a basket of toys in front of Rayhan, and she tells me that now he can choose and take out the toys himself. But he doesn't reach into the basket. Instead, he pulls up the bed cover underneath it so that all the toys spill out. and the thought of the wrench of his having to leave her keeps coming into my mind, and I feel a sense of dread. Rayhan grew into a sturdy toddler, confident and lively. The foster family facilitated and supported my observations, but I found it difficult to stay connected with the social workers. And towards the end of the observation, when the adoptive family had been identified, I became alarmed when I heard that the planned period when he would be introduced to the new family, which usually, the planning of these usually takes at least 2 weeks, often longer, was shortened to 4 days. And perhaps now I had been identified with some aspect of his vulnerability and need that could not be tolerated, as I found myself now being blanked and lacking a voice. So here's a note from about a telephone call. I contact Daniela, she's his social worker, about the idea of meeting, which we talked about before, with the adoptive parents to discuss continuing the observations in Rayhan's new home. And she tells me the schedule is too full. So that the idea that an element of continuity provided by the observation could be helpful for him has got lost. So really recognising a risk of repetition of the unmediated move on the day of Rayhan's birth, which I'd heard about, led me to take up a more active role at this point in the professional network. And I think it was speaking from observational knowledge and the experience of being there that allowed me to advocate for more integrated transition and a greater degree of continuity between his foster and adoptive homes. So the plan was developed, really. As the move approached, just after his first birthday, Rayhan seemed to withdraw into himself, perhaps in unconscious response to a Nadira who was practicing in her mind to let him go. But it was also during this period, interestingly, that he spoke his first words. This is an observation just after his first birthday. Rayhan looks towards me with a dreamy expression. The wind rises in the alleyway, and he says, "Oh," making a sound like the wind. And he goes in and out of the house repeatedly to watch Nadira using the hoover. When she's finished, he goes up to the hoover and touches it, smiling proudly and looking round at us. And Nadira tells him that he's brave, and she praises him. And he says, in a long exhalation, like a sigh, "Hoover." And we all comment on this word that he's now got. In the last observations in the foster home, I felt a mixture of panic and disarray, while at the same time recognising that Rayhan, now almost 13 months old, had been able to internalise something of the attentive and mindful care that he'd received from the foster family. This is an observation just before he moved. Rayhan plays a slow game of peekaboo with me, which feels very kind of serious and sombre, actually. And then he brings me the duck toy, watching me carefully, and gives it to me and then takes it back many times, over and over again. And then he throws it on the floor. He picks it up and holds it close, embracing it and burrowing his face into it. As he watched my face intently throughout this play sequence, I came to feel that Rayhan might now be able to hold on to a sense of himself being held in mind across this move to a new home and a new family. Unfortunately, the adoptive family did not feel able to continue with the observation, and with hindsight it seemed that the social workers hadn't been sufficiently connected to this project to enable them to speak for the potential value to him of continuing. So this was something we noted as a learning point for future interventions of this kind. But I was happy that in my follow-up visits to the foster family, which went on for over 6 months after he left, I heard of a growing closeness between the two families. I'm going to say something very briefly about the data analysis. So I use grounded theory to analyse the materials. So this is a method rather like infant observation itself that requires a letting go of familiar conceptual landmarks in favour of receptivity to connections and themes that suggest themselves, emerge from the data is the idea. As you sift through it. So starting from line-by-line codings of the observation notes, my supervision notes and field notes, I came to a core theme which was coming together and apart. And I then identified 4 modes of coming together and apart, which related to modes of functioning, which I'd observed in Rayhan with Nadira, the foster mother, in what I saw and heard about the group dynamics of the professional team around the child, but also in my own feelings evoked by what I saw and what I heard. And I chose metaphors for these dynamics, which were matrix, I'm going to write these up, matrix, tornado, machine, and limbo. And I'll just write these up.
Do you want me to do that for you?
Yeah, thank you very much. Thanks.
Say them again, matrix.
Matrix.
Yeah.
Tornado. Machine. And limbo. Thank you. So I'm going to just briefly outline each of these and then say something about some of the ways in which I thought they kind of interacted. So I'm going to start with matrix. The moment that I described in the first visit, when Rayhan gravitates towards Nadira after their first coming together has been remembered, is an example of a matrix dynamic. With the coming, and what I'm interested in is how one connection can generate more connections in this frame of mind. With the more contained and lively closeness between Rayhan and Nadira, I myself felt able to connect with the two of them and to make connections in my own mind between past, present and future. So this is a mode where there is a temporal sequence and it's possible to remember the sequence in time and to differentiate past, present and future. The games that Nadira played with Rayhan, like Round and Round the Garden and Peekaboo, helped him to join up with himself and to develop a sense of his own agency. At the end of the observation, there was a sense that the experience and internalisation of a good object, a good person in mind, had provided Rayhan with a stable sense of going on being. Another aspect of matrix functioning at the end of the observation was the capacity in the foster family to link to Rayhan's adoptive family, despite fully feeling the trauma of their own loss, and the capacity in the social work team to validate and support the continuity of relationships for him. They listened to what I had to say and took it on board. Now, in contrast, the other 3 modes of functioning do not allow contact with emotional reality. And interestingly, thinking about some of the themes thinking about temporal sequence, these are all modes of functioning where the sequence of time is impacted on. In tornado, contact with emotional reality is precluded by fragmentation. So, for example, during my first visit, Nadira's description of her first coming together with Rayhan is quickly followed by the introduction of the idea that he could go at any time. That's an example of tornado functioning. So in this mode, there's no time for getting to know and there's no mediation. Things happen very suddenly. In fact, you feel they've already happened by the time you've noticed that it's happening. Tornado dynamics often involve feelings of being blown away, blown apart, or in bits, and there's often a sense of tremendous pressure and tremendous confusion. Machine dynamics are those of dissociation, and here the threat of too much trauma leads to cutting off from emotional reality, something obviously we all need to do some of the time. Feelings and thoughts are disconnected, people are treated as things. The care system is experienced as a mindless bureaucracy, a conveyor belt system, as one social worker put it to me. So the ideas that one person is replaceable by another, or that babies forget, these ideas are sort of machine ideas, and they undermine efforts to promote continuity and to create ongoing links to mediate the transitions that children often have to have. And lastly, limbo describes the excessively long periods of waiting which are a notorious feature of life in the care system. Uncertainty and provisionality, each in their way, leads to a blurring of boundaries and feelings of suspended animation. Development is on hold, feelings tend to be numbed, identities are confused, so there was that kind of merging that I talked about between Nadira and Rayhan, or this sense of, is it nighttime, is it daytime, what time is it, we don't know. Past, present and future seem to merge in a general sense of passive withdrawal. So limbo has many, many kind of problematic aspects, but of course in another way it offers some reprieve from too much contact with reality. In the course of the observation, these modes of functioning overlapped and fluctuated. What I came to think was that the dynamics of matrix facilitate and they're organised by development, whereas in that mode of functioning there's a recognition that no one person can do it all, so dependence on others and group working is possible. Foster carers and other professionals can also grow emotionally and learn from working together. And care planning focuses on an individual child's needs. In contrast, tornado, machine and limbo, I think, can combine to create an organisation driven by trauma, which is a vicious cycle in which shock and confusion escalate and contact with emotion and reality is in danger of being lost. And this can lead to decision-making for children that no longer has the child in mind, and then we're sort of in a dangerous territory. So in conclusion, carrying out this clinical research enhanced my work as a child psychotherapist. I came into contact with the powerful emotional experiences of this foster family and baby, and with the impact of Rayhan's move into adoption on the family and on the professional network. But the observation also highlighted elements of the universal experience of babies in the care system. And following this research and its dissemination, we've had quite an increase of referrals of infants and young children to our service. The service has changed quite a lot, and we now offer a range of observational interventions for children and babies in care, and we also work with social workers to support them to use observation to guide decision making and work with infants and young children in care. Thank you.